it's not gone. It's out there, and we call it endemic. It's in the population, and it spreads easily enough that we are not going to get rid of it. And so the concern is we all rush out of our houses, and within a matter of a month, we'll be seeing a huge resurgence in cases as we get re-exposed. And that's what we cannot let happen. So we need very good testing. We need to know, in particular, we need antibody testing so we can start to see who has developed immunity to the disease. And there's some interesting possibilities there in terms of making people who are immune, putting people who are immune on the front lines of risk, because they're A, not going to get it again, and B, not going to spread it. And I think we need to develop better models to describe what is putting people at risk, both externally and internally. Who are the people who are most at risk? Because I think we're going to need to be looking at different levels of protection for different people depending on where they fall on that risk spectrum. And I think we need to really improve our models for how the disease spreads, so that when we see a case, we can track it. We can, as we discussed earlier, we can kind of throw a net around that, the contacts and the people that are at risk. So instead of putting the entire population in quarantine, we can isolate the people who are actually at potentially developing the disease.